Thank you, Stephen. Thank you so much, and welcome everyone. I am so happy to be here with you tonight, sharing a little bit of information on a topic that it can be rather difficult, but we'll make it interactive and a little bit more palatable for everyone. Um, Hopefully, you'll get to take away some of the information and we want to get the conversation going and overcome those fears that come with the C word, the word cancer, that we often avoid saying. We do not like to say it, but it's necessary. So we have to confront that fear, and the more informed and aware we are, the more resources we have, the better we'll be able to cope and deal with something like a cancer diagnosis for ourselves or perhaps a family member, a friend. So it's always good to be informed, especially about a disease that affects so many people in our community, unfortunately. So okay, here we go. So like Stephen mentioned, my name is Angelica Medina. I am the outreach program supervisor for an initiative called Sisters United. We are part of the Adelphi breast cancer program. And the program has been in existence for 41 years. We are part of the Adelphi University School of Social Work. So that's where we live. We are a nonprofit organization and we don't charge for any of our services. They're completely free and confidential. We believe that when someone is diagnosed with breast cancer, the last thing we need to worry about is about all these other barriers. So we want to help people break through those barriers and not create more. We have a hotline that is sort of how the program was created 41 years ago. So at the time, people did not say the word cancer, let alone breast cancer. So it was called the Woman to Woman Hotline. And people will call to find out more. It was originally started by a group of women who just wanted to support each other through a diagnosis, and they got so much out of it that they wanted to do it for other women as well. So the hotline works every single day of the year. We often get calls during the holidays, women who have just been diagnosed, or perhaps a family member who is trying to help their loved ones in the process. All sorts of calls. We get calls about getting a mammogram, or about how to talk to a friend, or how to tell your children that you have been diagnosed with breast cancer. So that's our hotline. That's what's there for, and it's staffed by people who have been touched by it directly, women and men. We also have men who are volunteers, and they help us with these calls, and they have been professionally trained by our social workers, and they, like I said, they're available every single day of the year, so to answer any of your questions. We also have support groups, which traditionally we have on site at the university, but because of the pandemic, we are now we have them virtual, and it has been working fine. We have actually been able to help people who otherwise wouldn't be able to get to us, which is sort of like the silver lining of the pandemic. We have to find the positive in everything, right? Um, so we have our support groups. We have different types of support groups because people are different too. So we have had support groups for men only, or for women with metastatic disease, or for women under 40, for example, because they all have very different needs, even though the diagnosis is in a way the same. And we also offered one-on-one counseling. Our social workers who are licensed, they provide this counseling as well. They're doing it virtually now. They can do it on through Zoom, over the phone. We also have a chat feature on our website, so you can just ask questions through the chat, and you can choose to speak to a volunteer or a licensed social worker. And we also have our education and outreach programs, and this tonight is an example of that. So all of our services we provide, again, free of cost. They're confidential, and we have them in English and Spanish, all of them. So we also have other education programs. Next week, March 1st, we'll be having a program designed to lift your spirit. So anyone who has been touched by breast cancer is invited. We're going to have speakers talk about Reiki, nutrition. They're going to share some recipes, healthy recipes. So it's, we're always trying to fulfill the needs of our community. And this is something that we all really need at this point, and lifting our spirits, right? So you're all invited. I'll be happy to share the information as well. But it's March 1st, and you can go to our website to register, or you can call our hotline. The number is on the screen, and you can register. It's 1-800-877-8077. And to tell you a little bit now about our Sisters United project, and it has been going on for about 20 years. And the specific goal of Sisters is to reach women before there is a diagnosis. So we do the prevention part of it, the risk reduction part of it. And that's sort of where I come in the program, along with some volunteers, with another educator, and also our student interns. And before the pandemic, it's hard not to compare the before and after, but we used to be in the community regularly, and we would do these sort of programs on site. So I look forward to the day where we can do it again. Perhaps we will meet on site someday at the library. So these are some of the events we used to go to. Okay, so breast cancer. Let's kind of jump a little bit on into the topic, and feel free to unmute yourself if you want to share anything at any point. But if you also like to type on the chat your answers or any other comments, that would be great too. So when you hear the words breast cancer, what does that make you feel? How do you feel? I'll try to keep an eye out for the chat too. Oops. Okay. I think it's usually not a lot of positive things, right? All right, I see someone. Oh, okay, thank you. Yeah, so feel free to unmute yourselves, please, or just write it on the chat. What does the word cancer make you feel? Okay, perhaps fear is the most common that we see, and if you could also like raise your hand or give the thumbs up if you agree with that. But it's normally fear. People think of that, but so it's normal to, it's a reaction. When we hear those words, we tend to feel also like we're alone, and but it's very common to have that association with very negative emotions, right? Okay, so again, the goal of this, our goal is to start the conversation, create the awareness, and empower you so that you know what to do starting now, and make some changes so that you can help your body reduce the risk of getting breast cancer, but also know what to do if that happens. So once you get to that point, you will feel empowered, and a diagnosis is never easy, but if you have the information and tools, it can definitely come in very handy. So why do we speak about breast cancer? Well, breast cancer is the most common type of cancer among women. It is estimated that the risk of a woman to get breast cancer during her lifetime is 1 in 8. So that's pretty high. And we're actually, that figure is getting like smaller. So it will be like 1 in 7. So more and more women are being diagnosed with this disease. The good news, because we want good news, is that when detected early, breast cancer has a very high survival rate, and it can be higher than 90%. So most women who get breast cancer survive. We also talk about it because Long Island is our home, and it's one of the hotspots for breast cancer in the country. So as you can see, Nassau and Suffolk counties have very high incidence, which means like new cases of breast cancer in a year. So much higher than the country itself or even the state. So, and usually developed countries have higher rates of breast cancer than developing nations. So we're already on the higher incidence, but then again, amongst the higher incidence, we have like some of the highest numbers of breast cancer. So that's why we need to get this conversation keeping it going. It has changed significantly throughout the years from 40 years ago when the hotline started with nobody saying the words cancer. Of course it has changed, but we need to keep this conversation going in spite of the progress and success that there has been in the past years. Mortality is also higher, especially for Suffolk County. So that's another reason why we discuss this topic. There's also, we hear a lot about health disparities, and they're very real. So breast cancer affects women from different ethnic or racial groups differently. We know that African American women, especially those under 45, have the highest incidence of breast cancer, like the women under 45, and very aggressive types of cancer, breast cancer. They're also diagnosed with larger tumors. Same for Hispanic women. They're usually diagnosed at later stages of the disease. So those are things that can affect your survival rates. So as you can see there, white women, for example, they have a higher survival rate than Hispanic women, and African American women have the lowest survival rates because of breast cancer. So even when they're going for their mammograms, and also when you take other factors such as insurance or health or the quality of healthcare, they might still experience more negative health outcomes. Okay, so so that can happen for many different reasons. We do know that for some women, access to quality healthcare and health insurance is definitely there are definitely factors that can play a role in not seeking medical care or not receiving medical care on time. That's why diagnoses get delayed and treatment gets delayed as well. The quality of treatment can be also a factor there. And there could also be biological factors. So genetically, some women are more likely than others. We know this about some Jewish women and also African American women. Like I said, the women under 45 tend to develop a specific form of breast cancer that can be more aggressive. So that's why those variations and those disparities happen. Um, so now jumping a little bit about the information that we hear a lot of things. So I find like this is probably the easiest way to tell you about breast cancer, by sort of having this um, conversation in terms of the things that we hear. We hear a lot of things we get our health information from different sources, right? We get it from the media, we get it from family members, all different friends. Some of us, might read a newspaper or online. Like I know people get their health information even from Twitter. So it could be a lot of different sources. It doesn't mean that all sources are valid and reliable. So we have to be mindful and we have to pay attention to the validity of that information they're giving us. I know, for example, like even on the news, sometimes you hear things like, oh, coffee is great for you. A study said that coffee can improve your brain health, right? Or your mental health. And then a month later you hear the complete opposite. So so that can be the case for a lot of things, and it can be very confusing. For example, I know when it comes to breast cancer, women hear that they should go for their mammograms at 50, and sometimes it goes back to 40, and sometimes they tell you, oh no, check with your healthcare provider. So it could be, there's so many different types of messages, and it's not always fair because we get confused, right? So so let's go over some of the things, and hope maybe you have heard of some of these myths and truths, but let's go through some of those. So this one is very common in some communities. I know I personally heard it when I was much younger. So bruising or pinching the breast can cause breast cancer. So again, feel free to unmute yourselves or type it on the chat if you want. Or you can raise your hand. I think there's an option to say yes or no. If you if you go to your menu, you can say yes or no. And let's see. Okay. All right. So okay, so that is false. Bruising or pinching the breast does not cause breast cancer, but it is one of those myths that have done the rounds at some point. Of course, if you bruise or pinch the breast area, you need to seek medical attention, especially because it can cause other type of problems, perhaps blood clots or maybe an infection. But in terms of breast cancer, you don't have to worry about that. So women with larger breasts have a higher risk of getting breast cancer. So that has been, that has also been out there. Um, and if you think about it, okay, so if a woman's risk, if someone has bigger breasts, perhaps the risk goes up, right? Because they will have more tissue. So that's something that the rationale behind this kind of idea. And that is actually false. So the size of the breast does not have anything to do with cancer risk. But we're going to talk about something that does, and that is breast density. So this is actually a great organization, that's dense breast info.org, and they have been pioneers in the study of breast density and breast cancer. So um, the and breast density is different from breast size. It has more to do with the type of tissue in the breast rather than the size. So if you have fatty tissue, this is how you're going to see it. So your image here, this is how you're going to see. You see that arrow, that would be something suspicious. That's a small cancer. But if your tissue is fatty, it can be easily seen, or any abnormality is going to be easily seen on a mammogram, because on the mammogram, um, fatty tissue would look darker, and so then anything that's abnormal, all the fibers and everything else, or the nodules, are going to jump out. They're going to look white, right? But if you have more of the dense breast, meaning you have less fatty tissue but more fibrous tissue, that's gonna look white. So it all kind of jumps out, right? As you can see on a dense breast. So if it's all white, it's very hard to tell when something is going on. So by the time you see it, it might be bigger, or it can be, even though radiologists are trained to observe these differences, it can be rather difficult to see, especially if it's something, to catch something when it's really small. So so density can make detection difficult as well. So that it's important, if you have dense breasts, by law in the state of New York, they have to tell you, your report, your letter should say whether or not you have dense breasts. And if you do, the recommendation is that you have an ultrasound or a sonogram in addition to your mammogram. That's always a good idea. That's always the doctor's recommendations as well. So some women ask me, okay, can I do just this sonogram or the ultrasound instead of the mammogram? Obviously, because they're a little hesitant to have a mammogram. And no one likes to think about having a mammogram. It doesn't seem like the most comfortable exam, right? So it's understandable. But sonograms and mammograms are very different kinds of tests, and they tell different stories that, when put together, increase the likelihood that of detection, right? So one does not replace the other. They work in conjunction to increase the chances of pinpointing something that is developing early. So so that's the advantage when needed of having both of them. But again, one does not replace the other. Mammograms are great at showing where something abnormal is developing. Sonograms are great at letting you know what that something is made out of, right? Is it water? Is it fat? Is it, more of a solid mass? So that's where sonograms can be helpful as well. Okay, and this one's rather simple. Men can get breast cancer. I can tell you, when I started doing this work, a lot of men will tell me men cannot get breast cancer. Men don't have breasts. So I would tell them, okay, you can call them pectorals if you want. You don't have to call them breasts, but it is possible for men to get breast cancer. We have seen it. We have some volunteers also at the hotline who help other gentlemen who have breast cancer. So it is true. It does happen. It happens much less than it happens in women, but it happens. It's usually a 1 to 100 ratio. So it's a pretty big difference. That means for every man that gets breast cancer, 100 women get it. So that's something to keep in mind as well. I don't have a family history, so I'm not at risk. And that is false because most people who get breast cancer do not have a family history. They're starting their family's history, unfortunately. This is one interesting message that I have heard. People have expressed this in our education programs. Women should not get mammograms because the radiation increases the risk of getting cancer. So I can understand if you're concerned about radiation. Absolutely, radiation in increased amounts can be harmful to our body. But mammograms do not have enough radiation, do not use enough radiation to be harmful to the body. You will need to get many simultaneously to get to that level. So, and with everything, when it comes to your health and most things in medicine, it's almost like putting things on a scale. The benefit and the cost and the benefit of mammograms far outweigh any concerns that we might have or even the little bit of exposure to radiation. Besides, we're exposed to radiation from so many different sources, especially these little things here. And we know we're not getting rid of those phones, right? Or even in the summer, I'm sure, as soon as we can get to the beach, we'll be under the sun, and the sun is a huge, probably the biggest source of radiation. So I know that's a concern, but it shouldn't be when it comes to mammograms. And there are things that I can do to reduce my risk of breast cancer. And that is true. So there are things that you can do to reduce your risk. You don't have to feel powerless. We're going to take a look at some of those things. And so first, we're going to talk about the things that can increase or decrease your risk. But you don't have we don't have much control over that. So the first thing is being a woman. Like I said, women are more commonly affected by breast cancer than men, the 1 to 100 ratio. So being a woman alone, and that has to do a lot with our hormones, especially a hormone called estrogen. We have a lot of more estrogen than men do. And what we do know is that estrogen can, exposure to estrogen through our life can increase our risk of breast cancer. So what you observe here is like this woman is aging. So aging can also, that's the other risk factor that we cannot control. The more we age, the more risk we have of getting breast cancer. And you have your genetic and your family history. But like I said, most people don't have either one of these factors. It's less than 5% of the cases when that are related to genetic factors or family history. Of course, if there is someone, if you have multiple family members or a relative in the first degree that has been diagnosed with breast cancer, particularly if they are under age 50, for example, which is a non-common age, it's still too early to be diagnosed. If you have, let's say, a sister at age 40 who got diagnosed with breast cancer, that's a red flag that you should look into, as opposed to maybe having an aunt in her 70s or 80s who got diagnosed. That is not much of a red flag. So that's the idea. And in terms of genetics, there are some gene mutations that are associated with breast cancer development, the BRCA genes, for example. So mutations to those genes can increase your risk. But again, it's not a high percentage of the people who develop breast cancer. Some other types of cancer can be related to breast, especially in the families or when it comes to genetics, such as ovarian cancer and colon cancer as well, and prostate in men. And this is what I had mentioned about the hormone estrogen, because the more estrogen we're exposed to throughout our lives, we are increasing the risk of breast cancer, unfortunately. And sometimes environmental factors can have something to do with our risk as well. We certainly know that because living in Long Island, we know there's something about our environment here that it can increase our risk. We don't know for sure what that is yet, but there has to be an environmental component to explain why so many women in a particular area of Long Island are more likely to be diagnosed with breast cancer. So that has been studied. It continues to be studied. And unfortunately, we don't have the exact answers yet, but it is something to keep in mind as well. Okay, so now let's talk about the things that we have some control over. So I love this because it's a really nice painting, but it's also, it's one that shows a lot of the things that, a lot of the behaviors that people, that might increase our risk of breast cancer and other diseases as well, chronic diseases. So as you can see, she is having a drink. So the drinking part, then there's also quite a lot of cigarette butts like on the floor. She's smoking. Also, there's obesity going on, and she seems, just sitting down, looking not so, perhaps looking a little depressed, but not really active. So those are some things that some behaviors or some factors that can increase our risk for disease, and breast cancer is no different. So for that, and that you have probably heard this many times, and especially when it comes to breast cancer, eating a diet rich in fruits and vegetables is probably a factor that can deter some of those biological processes that can take place in cancer development. Those colors in the fruits and vegetables are reflective of nutrients, and those nutrients can help our cells and can help our immunity against diseases like cancer. Okay, it can block like tumor development, and there's a lot of science and investigations going on around that. And definitely try to make your diet around a lot of the plant-based foods, a lot of the whole grains, a lot of the vegetables and fruits for sure. And then in decreasing amounts, some of the other foods like fish or chicken, definitely like the oils keep to a minimum. So, but definitely emphasize plant foods, because those have the nutrients that can help you. They can also help your body stay at a healthy weight, which is important, because when someone gains weight, when we gain weight, our fat cells will hold on to estrogen. So like remember what I said about estrogen, the more we're exposed to it, the higher our risk for breast cancer. So if we have more fat cells in our body, we're increasing our estrogen levels, and that increases our risk of breast cancer. So we want to make sure that we have a healthy weight. We can also accomplish that through exercise. I know these days it's hard to go around, go out, and for those of you who might have been going to a gym, I'm not a gym person. I'm not going to say that, but definitely trying to be creative and stay active even when you're home. I do love to dance. So, that's good. That's my activity, my daily activity here at home, or, a stationary bike, or whatever you can to kind of get your heart going and burn the calories. And it's also going to stimulate those endorphins in your brain too, which can have that healing effect as well. And this is also significant for people who have already been diagnosed. So I know a lot of times we make those changes after a diagnosis, but if we do it before, that's even more ideal, right? And alcohol definitely has been linked to breast cancer. It can disrupt our hormones, our own balance in the body. So definitely, the guidelines for alcohol intake are 1 portion a day for women and 2 for men. And by a portion, that's 1 glass of wine, not a bottle of wine. And of course, there's different ones, but for beer, etc. But yes, so if you can limit your alcohol intake, that's even better. And no, if you don't drink during the week, you don't get to have your 6 servings on Saturday. It doesn't work that way. And as far as cigarette smoking, there's no limit, simply 0, 0. And we know we have plenty of information on how to do that too. There's just cigarettes are, overall, we know breast cancer is not on the top of the list of diseases that are linked to cigarette smoking, but it is certainly one of those behaviors that are extremely detrimental to our health. And breastfeeding. So breastfeeding has the opposite effect. It can protect. So women who have breastfed their babies for especially close to a year or over a year, that has a protective effect and can reduce the risk of getting breast cancer. So even if you breastfed, let's say you had 2 children and you breastfed each 6 months, that can accumulate, and it has that protective effect of the whole year. So breastfeeding is always a good idea. It's good for the baby, and now it can protect the mother against breast cancer. And there's other factors as science has evolved and has become more, scientists start studying the effects of our environment and the products that we come in contact with and the types of diseases we might experience. There's a lot of links, unfortunately. And just like many years ago, we found lead in paint was linked to many diseases, especially in children. The same way and the same thing has happened with other chemicals and breast cancer. So there are thousands of chemicals in in the market, and being used in products that we come in contact with all the time. And unfortunately, most of those are not regulated, not even tested. So it's a problem. If we can avoid some of these products, that's in our best interest as well. So we, from the moment we wake up, especially for women, I feel, we use so many products. We start, like, okay, we soap and toothpaste and cream and lotions and shampoo and conditioner and deodorant, and it's just, and before you leave your house to go to work, you've gone through like 12 different, between the makeup and the perfume and everything else. It's probably over 12, 15 products that we have in contact with. So if the exposure, if there was just a problem of a single exposure, it wouldn't be too bad. It's not like if you're exposed to it once, you will get a disease. It's more about the accumulation of that effect. If throughout our lives we use 10 to 15 products every morning, oh, pardon, my assistant woke up. So that can be a problem. It's the accumulation of those chemicals. We're talking about phthalates, about sulfites. Um, there's just so many of those chemicals, BPA, and especially in plastics. And Suffolk County, for example, was one of the first counties to ban BPA, which is wonderful. They have been pioneers in this. I want to give a shout out to the Huntington Breast Cancer Coalition, for example, because they do great work with prevention is the cure. And they have great information also on these environmental factors and breast cancer. So definitely something to be on the lookout for. It's not a coincidence that we see a trend in terms of the market, because there's that demand as people become more educated and savvy about the effects that these products have on our health. There's a demand for natural products that use ingredients that are not as harmful. So in general, just try to avoid products that have these harsh chemicals, but also avoid anything that says fragrance on it, because usually that artificial fragrance really means those chemicals, and they're not really bound by law to list any of them or to even discuss the harmful effects of it. So if you can, also use things that you have at home to clean, and also for self-care. I know, for example, baking soda and lemon are great for cleaning, along with white vinegar. They're wonderful for cleaning. You can use coconut oil or olive oil for your hair, for as hair treatment, or to remove makeup. So that the more you use these products, that at least you know what they are, you'll be reducing your exposures. And there's so many resources online now, especially there are apps for your phone where you can take a look at some of these chemicals. You can scan a product and it will tell you where on a scale it ranks from, not dangerous at all to very dangerous. So that's something, fortunately, we have the technology now to be able to use some of these tools. And the Environmental Working Group, for example, has a great array of tools, from anything from makeup to cleaning products to other household items that they classify into different categories. So it can be really helpful. And even when you go, we know the products that are less harmful are now easily accessible. Places like I don't want to call out a store, but like Target and even the local pharmacies, Stop and Shop, like they all carry a lot of these brands that are now resorting to more, to less harmful ingredients. So that's always a good idea. Um, and to kind of jump into like the last section, I want to talk and leave you with information about early detection, because sometimes, you know, we can do things right, and most likely you're trying to avoid some of these products, and even though it's extremely difficult to avoid them completely, but you might want to take, or you have been taking some steps, or perhaps you already eat plenty of fruits and vegetables, and you don't have any family history, and that is wonderful. However, it's that's only one piece of the puzzle. We have to put it all together. So the other piece that comes into play is early detection. We need to take steps to detect breast cancer as early as possible, because if you remember initially, I mentioned, if when detected early, there's an over 90% survival rate. So that is amazing. So we need to be proactive about taking those steps. So what is part of early detection? What does this mean? Well, it means that I know my body. So anyone, any woman, especially women over age 20, they should know their body, and you get to know your body in your breast area by touching it. So it's important to go through that process, especially at least once a month. Like you can do once a month. You don't have to do that systematic breast exam they used to teach people or women, you know, when you just turn this way and do that and do the Cirque du Soleil dance. No, you just start by knowing your body and know of any changes. So you want to observe if anything has changed from one month to the other. You can do that if you're watching TV, if you're watching a movie, just start, you know, touching the breast area. Or if you're in the shower with a little bit of soap and water, just start the process. And when I say breast area, I don't just mean the part that fits in your bra. I also mean the area of your collarbone right here, the sternum, all the way down. You go to your ribs, and also your underarm is very important as well. So don't just check the area that fits in your bra. That's not the entire breast area. So that's very important. And you're looking for signs that something is changing, like lumps that are hard, that don't move, any thickening of the skin, any swelling, any changes in the color and the texture of the skin. Just picture like sort of like the peel of an orange or a lemon. If you see that dimpling, that can be a sign. Doesn't mean you have breast cancer. No, it means that it's time to go to the doctor and get checked. So this is another campaign that I really love. It's called Know Your Lemons. And they have great tools too. They also have an app, because there's an app for everything these days. But these are some of the signs that, and symptoms, some of the signs in breast cancer. So like I said, you have here on the bottom, the hard lump, but then it can go to, you know, any unexpected fluid from the nipple, or a big dimple, or the small puckering as well. Sometimes the nipple might be like almost turn inward. So any of those changes. And it's normal for women to have certain characteristics. Maybe one breast can be slightly bigger than the other, or a little shaped differently. That's not uncommon. The problem is when something has changed from one month to another. So that's what you need to be on the lookout for. So the best way to do that is to know what is normal for you. So this can really help. Now, the second tool that we have in early detection is the clinical breast exam, and that is usually done when women go for their PAPs, their PAP test for cervical cancer screening. Usually, well, now women only have to do it every 3 years, but it's still a good idea to get your clinical breast exam every year, especially if you're over the age of 40. So in addition to you knowing your body, your doctor is also going to palpate the area to look for anything that might feel abnormal. So again, it is done by a healthcare provider, and ideally, like if you're between 20 and 39, you can get it done anywhere between 1 to 3 years. But after age 40, because your risk, that's when your risk starts going up, you should really do it every single year. And last but not least, the screening mammograms. And mammograms are the best tool. I know they're not the most appealing tool. I know they can look very intimidating and like it hurts, but it's mostly uncomfortable, and it only lasts for a little bit of time. It's no more than 10 minutes. It's like 5 minutes on each breast. But it's necessary and it's worth it. And again, it can be a little uncomfortable. I'm not gonna lie to you. But there are things that you can do if you want to perhaps take up something for pain, like Tylenol, for example, before your test. That's fine. But you know, it's necessary to get your screenings. It can detect breast cancer when it's very, very tiny, and that gives you the advantage. It gives so if there is something going on, detecting it as early as possible can be the difference between being able to take your time, make the best decisions, get a second opinion, get a third opinion, and that's what we recommend. We always recommend to get second opinions. That's very important too. So mammograms, they're a simple X-ray of the breast, and I know they've been telling women, oh, you can wait until 50, and that's a conversation that you should really have with your healthcare provider, because some women might have an increased risk because of their family history, perhaps because they smoke, or maybe they're taking some type of medication. So always check with your doctor. As an organization, we still recommend 40 and over, because we want women to get their screenings started as early as possible. So there are some medical organizations that continue to recommend women to start their mammograms at age 40, and we certainly recommend to do so. And the other recommendation that they're giving women now is to go every other year. We recommend every year, especially for the women that are experiencing those disparities. For African American women, for Hispanic women, we want them to go at 40 and every year. And for all women, I think it's a good idea for them to continue their screenings, and but also have that conversation with their doctor. If you have a family history, you might have to start your screenings before age 40. So it's usually 10 years before the age of diagnosis of your relative. So again, a conversation with your healthcare provider for sure, because that can change the guidelines, and you don't have to wait until you're 40 if you have that family history. Also, you don't have to wait until you're 40 if you have a sign or a symptom of breast cancer. So that's important to keep in mind as well. You don't have to wait for your mammogram. For some women, especially under 40, it can be difficult to get a mammogram, because the doctor might recommend other things first to observe. But I think if you have noticed the changes, and just listen to your body and um, and be persistent. Be really persistent. If you know something has changed, and you know um, there's a lump that has never been there before, be persistent. Perhaps get a second opinion. That's something you can do. And you can certainly call us. That is my direct number. So feel free to call me. That is my office. So I will be happy to help you. One of the things that we do in our program is link women to mammograms. So if you are in need of a mammogram and don't know where to go, I'll be happy to help you find a place. If you don't have insurance and you're over 40 and you're due for your mammogram, I know because of the pandemic, many women lost their jobs, and there goes their health insurance as well. We can help you. There is a program, the Cancer Services Program of New York State. They offer free mammograms, free PAPs, and free clinical breast exams for women over 50. And then 40 to 49 can be low cost. So we can help you get the services that you need. Don't wait. I know the pandemic has taken our attention, and duly so, from other diseases, because of it's an emergency. But we can't forget that breast cancer can continue to happen, and we don't want to delay our screening, because that can create another crisis in the future. So don't let the pandemic or the fear stop you from getting a mammogram. There are ways, that steps that you can take to protect yourself as you go for your mammogram, and also the facilities are taking steps to protect you. So make sure that you wear your mask, that you bring your own pen if you want to, that just take all the steps that are necessary, and reward yourself at the end after you've done something great for you. We can also reward you, because when we refer you for a mammogram and you get your mammo, we send you a $25 gift card so that you can reward yourself as well, and you deserve it. So feel free to call us. This is our number. So, and I'll be happy to refer you for the mammogram or help you find a place as well.